Everolimus is a medication that is used in combination with other drugs to prevent the rejection of a kidney or liver transplant. It belongs to a class of drugs called immunosuppressants, which work by weakening the body's immune system to help the body accept the new organ. It is typically used with medications like cyclosporine for kidney transplants and tacrolimus for liver transplants. The daily dosage and optimal timing for taking Everolimus will be determined by your healthcare provider. Before you start taking Zortress, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually every 12 hours with your other medications after a kidney or liver transplant. You can take Zortress with or without food, but it's important to choose one way and stick with it for every dose. Swallow the medication whole with a glass of water, and do not crush, chew, or break the tablets. The dosage of Zortress is based on your medical condition, response to treatment, lab tests, and other medications you may be taking. It's important to use this medication regularly to get the most benefit, so try to take it at the same times each day. Do not increase your dose or use this medication more often or for longer than prescribed, as it will not improve your condition any faster and may increase your risk of side effects. It's also important to avoid eating grapefruit or drinking grapefruit juice while using this medication, unless your doctor or pharmacist says it's safe to do so. Grapefruit can increase the chance of side effects with Zortress. Additionally, women who are pregnant or may become pregnant should not handle this medication or breathe the dust from the tablets, as it can be absorbed through the skin and lungs and may harm an unborn baby. Some common side effects of Zortress may include constipation, headache, nausea, and sores in the mouth or throat. However, if any of these effects persist or worsen, it is important to notify your doctor or pharmacist immediately. Serious side effects of Zortress can occur, but your doctor has prescribed this medication because the benefits outweigh the risks. Your doctor will monitor you closely to decrease your risk of serious side effects. It is important to inform your doctor right away if you experience swelling in the hands, ankles, or feet, problems with wounds, decreased sexual ability, in men, chest pain or pressure, shortness of breath, or unusual bruising and bleeding. Zortress may also make side effects from radiation treatment worse, so it's important to let your doctor know if you have had or are planning to have radiation treatment. In rare cases, Zortress can cause serious lung problems or a rare but very serious brain infection. It is crucial to seek medical help immediately if you experience symptoms such as shortness of breath, chest pain, clumsiness, weakness, changes in thinking, difficulty moving your muscles, problems with speech, seizures, or vision changes. Everolimus, the active ingredient in Zortress, may also cause an increase in cholesterol, triglycerides, or blood sugar levels. It may be necessary to have your levels checked periodically and you may need medication to control them. If you experience symptoms of high blood sugar, such as increased thirst, hunger, or frequent urination, be sure to inform your doctor or pharmacist. Although rare, a serious allergic reaction to Zortress can occur. Seek medical help immediately if you notice symptoms such as rash, itching or swelling of the face, tongue or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed above. Zortress, also known as Everolimus, can increase the risk of certain cancers, like skin cancer and lymphoma. Make sure to tell your doctor if you notice any unusual changes in your skin or any swollen glands. It also lowers your ability to fight infections, so be aware of any signs of infection such as a sore throat, fever, or cough. Additionally, using Zortress may increase the risk of developing a blood clot in your kidney transplant, usually within the first 30 days after surgery. If you experience any nausea, vomiting, or unusual decrease in the amount of urine, be sure to contact your doctor. Lastly, if you have had a heart transplant, using Zortress may increase the risk of death from infection, so make sure to discuss this with your doctor before starting this medication. It's important to take the prescribed dosage at the optimal timing for best results. Before taking Zortress, make sure to inform your doctor or pharmacist about any allergies you may have, as well as your medical history. Zortress may increase your risk of infections or worsen current infections, so avoid contact with anyone who is sick. It can also affect fertility, so discuss reliable forms of birth control with your doctor if you are planning to become pregnant. Additionally, it's important to avoid sun exposure and use caution with sharp objects. If you are pregnant or breastfeeding, consult your doctor before using Zortress. It's important to be aware of potential drug interactions when taking Zortress. This medication may interact with other drugs that weaken the immune system or increase the risk of infection, as well as ACE inhibitors. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Additionally, certain medications can affect the removal of Zortress from your body, which may impact its effectiveness. Examples of these medications include azole antifungals, macrolide antibiotics, HIV protease inhibitors, and rifamycins. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines while taking Zortress. If someone takes too much Zortress and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It's important not to share Zortress with others. Your doctor may also order lab and medical tests, such as checking your Everolimus/cyclosporine/tacrolimus blood levels, cholesterol/triglyceride levels, kidney function, urine protein, complete blood count, and blood sugar while you're taking Zortress. Be sure to attend all your medical and lab appointments and consult your doctor for more information. If you forget to take a dose of Zortress, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular scheduled time. Don't take 2 doses at once to make up for the missed one. It is important to store Zortress at room temperature, away from light and moisture. Be sure to keep it out of the bathroom and away from children and pets. Do not flush Zortress down the toilet or pour it into a drain unless instructed to do so. When the medication is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.